I'm Emily.
Hello, I'm Shakira, and I'm here to help you recruit GP practices.
So it's important to think about the needs of the study in terms of the size of the clinic, different flow of the clinic in terms of how the patients come in, what size the waiting room is if you're going to recruit them from the waiting room, or if they have enough GPs on in the time that you need. And then it's also important to think about the demographics of the participants coming through, potential participants. So whether they're all of one ethnicity or things like that.
Yep, so after you've thought about what the clinic offers and what you need for your study, it's important to include who you need to approach at the clinic. Sometimes it's the medical director, sometimes it can also be the practice manager. But ongoing, that can change as well. I remember for one study, I started with the medical director, and then I also needed to talk to the practice manager. But the practice manager was the one to make the decision, and then ongoing throughout the recruitment for the project, I was talking to the reception staff. So it changed over time, and it's really important to identify who you need to talk to.
Yeah, it's really important because sometimes it can be the reception staff, the practice manager, or the head GP at that clinic. So it can be any of them. So sometimes it can be a bad time for the clinic when it's a good time for us to recruit. So you need to think about not trying to call them in their busiest periods of the week. Don't try and call on a Monday or a Friday when they're starting or ending their week. They're usually overflooded with work and they can't deal with other things like research. It's also important to consider flu season and accreditation. We don't really think about accreditation that much as part of research, but it's a massive undertaking as a GP clinic, so it's best to just wait until that's all over and then start afterwards. But then flu season seems to be really important for some studies.
Yeah. So, for example, for one study, I was recruiting patients, and we started just before the flu season. And once flu season started, it was actually very beneficial for our study because so many patients were coming in to get their flu shots, and then we were able to recruit because there was the volume of people available. But then for another study, we wanted the practice staff to actually do something, and flu season was inhibitory, and we found that it was almost impossible to get them to do what we wanted them to do during that time. So after you know who you're going to approach at a clinic, it's also important to think about the hassle factor. And the hassle factor is the busyness of a clinic and our limited resources. As researchers, we have limited resources. Drug companies go in with money, with lots of food, and and sometimes we don't have that. I mean, we are trying to get their attention and get their time, but it's hard. So it's important to think about how you might sell your study as well. It also might take you 2 to 3 visits just to get in the door with the clinic. And it's also important to remember to be flexible and to be thankful.
It's also really important to think about networking, especially if you need multiple GP clinics. So sometimes practice managers actually work at multiple clinics, or they actually go and network with other practice managers, and they know all about these other clinics in the area or across the other side of the city. So it's really important to actually mention things like that to them because they might have great ideas and kind of snowball recruit for you, which you automatically kind of be able to walk through the door in that clinic because you already have a nice networking in on that clinic.
It's also important to think about how you might sell your study. Most times, it's very important to think about the fact that you're improving practice. Research is all about improving patient outcomes, and people work in GP practices for that very reason. So it's very important to think about that and to sell that. But also, it's important to be very realistic when it comes to setting the expectation for what you might need from that clinic. You don't want to come across as needing less and then once you get started having extra needs. So it's very, very important to be upfront about what you require for your study and what you're going to need over time.
Sometimes important to think about incentives for either the practice as a whole or the GPs that are involved specifically. We've used a variety of incentives over the years, and we've come across a few that are really useful. So obviously there's the monetary incentive. So there's also gift cards and education, and sometimes we can provide education as part of the study, which is upskilling those people in the clinic.
One study that I was working on, we provided an incentive for the nurses who were involved in the project to be included as authors on the publication, and it was really beneficial for them because it was also a co-design, and they felt very valued by that.
So remember, incentives aren't the reason they are actually going to participate. Nurture their genuine interest in the research itself.
It's also very important to be prepared during that first visit to a clinic. And you might be prepared by preparing PowerPoint presentations. When you also make first contact with the clinic, you might need a email template that you're going to send right after the phone call. And it's important to just enter very prepared and ready to answer questions as well.
Yeah, and it's also important to think about the fact that you're giving a clinic a lot of information. Sometimes they need some time to discuss this themselves, digest it, and then maybe follow them up in a couple of weeks to touch base again about where you left off.
Yeah, and once you follow up, they might have questions that you just can't answer. People do ask lots of questions and they do get very interested in what you're researching, but if you don't know the answer, that's okay.
So once the clinic's on board, it's really great to make sure you maintain contact with the clinic. So if the practice manager is the person you're talking to, just check in on a regular basis, maybe at the end of the day when you have been recruiting, and just give them a little update, tell them about when you're thinking of coming in next, and just keep them on board and informed so that they feel part of it as much as you are. Also, just check in with them about if they need any more resources or if they need anything from you, because that's a really good time to open that up and let them say, oh, I really need this from you, or that, or this is not working, and can we improve that?
Our last tip for you is to ask others in your research team or in your network about recruiting in GP practices. It's important to ask questions, although we've covered a lot here, and also reach out to PC4.
Yeah, so people might have actually recruited that clinic before, and it's really great to just touch base and see what their experience before. But also, you can always contact PC4. That's right. Thank you so much for listening, and hopefully it all works out for you in the long run.